Our final speaker today is Youcheng Wang. First and foremost, I'd like to thank him for hosting us here at the University of Central Florida, and compliments to his amazing team, who have been a pleasure to work with. So thank you so much. Youcheng Wang is coming from a little different perspective of hospitality and tourism management, and how that all fits in, and where does this help, and how can we engage the education of chefs in this process?
Well, good morning, everybody. I hope that you enjoy the conference. It's a great honor to have you here and to be the co-host of this conference. I have to start with a disclaimer. I'm not a food person, not a chef at least, right? You know, my only chef experience probably from time to time in my home kitchen. I'm not a medical doctor. Yes, I have a PhD degree, but my PhD is not in the medical field. My PhD in a Doctor of Philosophy, right? So I only work with people's mind. Unlike medical doctors, you work not only with people's mind, but also with people's body, right? When I talked with Dr. Holland a few weeks ago about some of the information probably we can share at this conference, which is called Culinary Medicine. And then I started talking about some of the other programs. Yes, we have a culinary medicine program here running at Rosen College for a few years already. And, I talked about some other things we have been doing here at the Rosen College. And one of the things is called the hospitality in healthcare. Sometimes, people call it hospitality to healthcare, abbreviation H2H. The idea is how to really transfer the culture and the spirit of hospitality to other industry sectors, particularly service industry sectors, particularly the healthcare industry. I think there's a little bit gap over there. And he thought, well, that's a great idea. Maybe you can just talk about something about that. Okay. So my presentation today will be not particularly related to culinary medicine or food related. I'm just talking about the conceptual work we put together in terms of connecting the hospitality industry with the healthcare industry. Now, being a co-host of this conference, I think I have the privilege of providing with you some basic information about this program. This is not for marketing purposes, right? This is just a strategy of getting you to know a little bit more about our program. So here you are. This is called the Rosen College of Hospitality Management. We are one of the 13 colleges of the University of Central Florida, which is probably 35 minutes away, 40 minutes away from here, depending on how you drive. UCF, of course, is one of the major metropolitan research universities, probably one of the largest ones. We have about 72,000 students on campus. But this is called remote campus, but typically as dean, I don't call it a remote campus. I call it location-specific education campus. Why? Because, this is the campus surrounded by the hospitality industry. When you get out of this gate, you will be really breathing hospitality, observing hospitality, seeing hospitality, talking about hospitality. You cannot avoid hospitality. And this is what we call the location-based education. It was done by purpose, because by educating the next generation of leaders for the hospitality and tourism industry, this is the best location, so to speak, because this is a live laboratory for doing research and doing educational programs here. So we started with a very humble start. 20 years ago, when I joined the program in 2003, the program was very small, 250 students, okay, and about 10 faculty members. And we occupied a few offices in one of the buildings. We call it classroom number 1 building, one of the major buildings on campus. That is how we got started. I got started at university. So as a newly hired assistant professor, I was so excited I did interview and I was offered the job, and then the associate dean at that time gave the key to me, saying that, congratulations, welcome aboard, and then here's the key to your office, right? I said, where's my office? And our office, a few offices at that time were on the third floor of the classroom number 1 building, right? And he said, if you go to the elevator area in the middle, and there's a big glass window, if you look outside the window, you will find your office over there, right? I went over there and looked. I looked to my right, to my left, and straight forward. I did not find my office, right? Because there was nothing at that time to the north of that building. It was a different university. UCF has grown so much in the last 20 plus years. So I went back, and I said, I see my office. And he asked me, how did you look? I said, I looked everywhere. I looked around. And he said, you looked at the wrong direction. I said, how? He said, you need to look down. I went back, looked down. Only structure I found out was a trailer. I came from the Midwest, right? I worked at Purdue University, UIUC, University of Illinois. I know that universities over there never put their professors or assistant professors in a trailer, right? But here you go. It's in the state of Florida, right? So that is how we got started over there. But by the year of 2000, we got major donations from industry led by a local hotelier by the name of Harris Rosen. So he has hotels around Central Florida here. He has 7 hotels in Florida. So he said, okay, maybe this is time. I need to do something. And he did something. He donated money. We got matching fund from the state, close to $40 million, and we built this resort-like campus dedicated to hospitality education and the research. Yes, it is not like an educational institution, but this is the environment we want to create for our students, because after their graduation, they are going to be the leaders of the hospitality industry. They are going to work in the hospitality industry. We want them to experience the resort type of experience in the hospitality industry from day one when they get to campus. So, just fast track, 20 years since I started. As we stand right now, we have 3,500 students enrolled in a program. We grew that from 250 to 3,500. So measured by that, we are the largest. Not only the largest program in the nation, but also the fastest growing program in our field worldwide. So we grew faculty members from around 10 to right now 70 full-time faculty members, coming from 17 different countries. So this is a very, very international program. We grew our program from only 1 undergraduate degree program to right now 5 bachelor's degree programs, 4 master's degree programs. Yes, we also have a PhD because we do a lot of research. Okay, so we have a PhD program in the college. Plus, we have about 10 tracks and certificate programs, including in the curriculum. So, in a nutshell, we have about 20 programs offered here in the college. So, this is the most comprehensive curriculum in the field of hospitality and tourism and leisure studies worldwide. Now, as a college, and to a certain extent, as a university, I'm not talking about our university, but universities nationwide. I think what we are trying to do is to so-called breaking the iron triangle for higher education. We know that higher education in North America is becoming very, very complicated, just like the medical field, right? And becomes more expensive. If you look at European models, Asian models, and North American models, probably I would say that we are the most expensive, right? If you take into consideration the Ivy League universities, the type of tuitions and fees they charge over there, and of course you understand what I say, right? So the iron triangle I'm talking about or referring to here is that how do you offer the best quality of education, okay, in a very affordable manner, and reaching the most of the population in the society, okay? So that has been something our university has been focusing on, to really transform the lives and the livelihoods of a lot of families in Central Florida and, of course, beyond Central Florida. So that is a very, very important mission for this college. Now, at this college at least, we have been focusing on two things in terms of the impact we can create. Over the past few days, I sat in some of the sessions, right? We talked about how to create impact out of our program. Yes, we can set up very, very beautiful programs, culinary medicine programs, from the grass level, from the communities, and so on and so forth, right? But how we can replicate that and to introduce some of the wonderful models to other communities, to other school systems, to other neighborhoods and the destinations from a tourism perspective, okay? So our belief is that, number one, of course, the idea has to be good. You have to be really doing good stuff. In our sense, in our perspective, of course, great curriculum, great program, okay? However, the other aspect that I mentioned is that, you have to think about the scale. You have to really think about the scale in order to create the impact. Otherwise, you will be an elite program probably. Yes, you are good, but you are an elite program and will not be able to really reach out in terms of the impact. So that is our belief. We believe that if you are focusing on those two things, you do a good job and you educate large enough people, students, over the time, and then you will create that impact. To put things into perspective, I want to compare this program with another very long-standing program in the north. Yes, in the north, right? Because this program, the college, we became a college in 2004. Really relatively young college, okay? And then our first program in this country in the area of hotel management, that started in a little university in the north, by the name of Cornell, I think, Cornell University? I'm just kidding, okay. So a very, very respectable university. So this set up the program, hotel management program, first one actually in the nation, a few years before I was born, right? So that was in 1922, okay? And we became a college in 2004, right? So if you look at our alumni base, we are already 12,000 strong. If you look at Cornell's alumni base, probably it's about, 14,000, 15,000 since 1922, okay? So that is really driven by this model. Excellence times the scale equals impact, okay? So everywhere, for example, I go, I travel, I cannot avoid being seen by some of our students. Of course, I don't recognize, every one of the students, right? And then when I check into the hotel, not only here in this country, internationally, you seem to be familiar. Do you happen to be the dean of the Rosen College? I said, unfortunately, yes. The other day I was in a grocery store and I was intercepted by the cashier. I said, are you the dean of the Rosen College? Yes. Okay. So that is our belief in terms of creating impact. I think, probably this is also relevant to some of the things we have been trying to do, right? How do we create the impact? How do we replicate some of the models we come up with and then, introduce that to more communities? As a research institution, of course, we do a lot of research, right? Applied research. So these are the 4 international journals we host here as a college, and probably this is the only college in the world which hosts 4 academic journals. These are highly ranked journals in our field, typically top 10. If you look at the first one and the third one, they are the number 1 and number 2 journals in our field, okay? Now, the research we do, of course, has to be what? Applied, which means that, it has to provide insights to industry practices. It has to introduce changes in terms of policies, right? So the nature of our research is very, very applied. Very different from medical research and some other hard science research, right? And hard science research, you have good ideas and you collect data, empirical data, you publish it, and then people will be able to see that, right? But in our field, it's not like that, okay? We publish a lot of papers, academic journal papers, okay? Including the 4 I just listed, All right? So as a college, we probably publish about 120, 130 journal articles in a year. Very, very high productivity, measured by different angles, right? But utilization of those articles is only limited to the self-referencing, self-citations among research throughout the world. Okay? And industry people don't read that because, they think it is boring. It is not relevant, right? So as an applied field, we have to do something to really make the connection between our research and the industry so that, our research can really influence whatever they do in the industry. So as a solution to that, we create a platform which is called RRR, which stands for Rosen Research Review. So basically, what we have done is that, we pick, in each issue of this, we pick about 10 articles we have already published. And then we worked with a research company in UK. They will redo the article, okay, completely differently. Of course, it's still the same language, English language, right? But they will do in a way that it is user-friendly to the industry professionals. They like it, okay? So when you look at the journal, right, or research magazine, it is not a typical academic magazine, right, or journal. In a typical academic journal, you will not be able to see all these pictures and so on and so forth. It has to be just dry and text intensive, right? Because that is the standard of those type of publications. But when you look at this, it's different. It's like a magazine, all right? So up till now, we have about 400,000 subscriptions worldwide, including electronic format. Okay, so that is another example of how we create impact, in the industry, right? I shared a few statistics about the growth of the college. It's largest one in the nation, fast-growing program in the nation. But I'm very, very proud to say that in the last 3 years, the program has been ranked as number 1 program in the nation and number 2 in the world by Shanghai ranking. That is one of the most objective rankings without asking questions about the perception. Everything's based on objective data, right? So obviously, I'm very, very proud of that, and all our faculty and staff members are very, very proud of that. Now, when you look at, for example, hospitality and tourism, education and research, our philosophy has been changing. I think it's because of the change of that philosophy, right, that puts us to the growth pattern, fast-growing pattern. That puts us as the number 1 program in the nation, number 2 program in the world, right? So how did that start? I want to use this tree. Let me just, for the sake of, lacking the name, I call it the tourism knowledge tree. This is the tourism knowledge tree, or you can replace that tourism word by hospitality tourism knowledge tree, right? When you look at North American curriculum structures in our field, this is a good representation of that, okay? So you have the trunk, the program basically, right? And the program has to be supported, just like any other programs. It has to be supported by what? By general education programs. Those are the roots of that big tree, right? So typically it's 2 years, right? And after that, you focus on the different concentrations under the big umbrella of tourism or hospitality. So, for example, we have a program in UNLV, Las Vegas. So the Preeminent focus on resort and gaming management, right? We have a program I just mentioned, Cornell University, the oldest program in our country, right? So their focus is on hotel real estate, financial management aspect of the hotel business, okay? When you look at University of Hawaii, their focus is more on travel and tourism, less on hospitality, okay? So every program is a little bit different. However, this program starts with a comprehensive viewpoint because we are supporting the largest destination in North America by visitation number. Before the COVID, we had about 76 million visitors coming to Orlando, the most visited destination. And in the next few years, all the leadership, in the tourism industry we talked about just, the day before yesterday, the mayor delivered his state of the county address. It's very, very exciting. The blueprint he mapped out for the future sustainable growth of this destination, right? So we have to be comprehensive to support this destination. We cannot afford to be just a hotel school or culinary management school or event management school or tourism management school. We have to include all those things, okay? However, we started that just with 1 degree program, hospitality. And then we put together some kind of tracks here and there, right? So since 5 years ago, we are changing that mindset, okay? Because it is very, very obvious that if we just focus on tourism hospitality only, to take an inward look, we will never be able to grow. And many programs throughout the world, they have already experienced that. Many programs, they have closed their programs completely. Or some of them have been kind of, merged into the College of Business. When you are merged into the College of Business, and then typically it is not a good position. Okay? So we say that, we need to think of a different approach, okay, to redefine hospitality. What is the definition of hospitality, traditional way of definition of hospitality? You have different versions. But I can define hospitality in a layman's words, maybe by a few keywords. If I mention those keywords, you will all agree that you are part of the hospitality industry. You are, every one of you. Okay? In a commercial context or home away from home, if you are eating, you are part of the hospitality industry. I believe everybody's eating, right? If you are sleeping, again, in a commercial context, hotels and resorts, you travel, right? You are part of the hospitality industry. Okay? If you are drinking, you are part of the hospitality industry. If you are moving around, the mobility aspect of the industry, right? Moving around, people travel to different places, people come from different places, you are part of the hospitality industry. Those 4 keywords. If you eat, drink, sleep, move around, you are part of the hospitality industry. Anyone here can raise your hand and say, oh, sorry, I'm not. I'm still not. I'm still not. You are all. We are all, right? I said, okay, that's really, really the traditional way of looking at hospitality. But I think, there's a different way of looking at hospitality. That is that, should we only treat hospitality as an industry only? That is the industry definition. Or we should treat hospitality also, not only as an industry, but also as a culture. If you look at hospitality as a culture, yes, we strongly believe this is something badly needed by a lot of other industries, particularly the medical industry, right? So based on that, we created this hospitality continuum from the hedonic to the utilitarian aspect. And in the middle, you still have the traditional hospitality area, right? You can extend into the hedonic aspect of hospitality, the fun stuff. You can also extend into the utilitarian aspect, hospitality. Not so fun, but it's very, very important, okay, for the experiences and also for the industry, from an industry perspective. Okay? So we started from there a few years ago, and then this is where we are right now. So our entire curriculum actually is built on this basis of treating hospitality as a culture in a continuum. Okay? So if you look at our programs here, to the left side, those are the fun programs. We have entertainment management programs. Oh, by the way, our entertainment management program, the orientation, is not focusing on performing arts, because we are not a performing arts school. We are producing leaders and managers to manage entertainment as a business. So many opportunities in Central Florida area and beyond. Give you an example. If you go to Disney and you ask Disney leadership or anybody in Disney and then ask them what kind of companies they are, they will never tell you that they are a theme park company. What kind of a company they are? Entertainment. We're in the entertainment business. Cruise line sector of the Disney, they will never tell you that they are in the cruise line business. They are saying that we are in the entertainment business in the sea. Okay? Universal is the same thing. Merlin Entertainment, of course, it's the same thing. There are a lot of events, sporting events, musical events, performing arts events, all these great opportunities for the students. Okay? So when we think about that, our eyes are really opening. Wow, we can, by doing that, we can really create a lot of opportunities for our students. Now, on the other side of the continuum, we call it utilitarian hospitality. That is where you tend to see some of our programs. We just, a few years ago, created a new program, which is called the Lifestyle Community Management. We are just changing that name. It used to be called Senior Living Management. But again, the orientation of the program is not from a medical or from a nursing perspective. The orientation program is to look at senior as a business and how do you manage that business. So a lot of people ask, what is the link between the two? I said, okay, if you are a senior living community or campus or company, when you hire, for example, workforce, what are some of the skill sets you need? Not including everybody, but for the majority, right? I said, we need marketeers, okay? We need technicians. We need PR people. We need catering service. We need people to manage spaces, right? We need to have a little bit of fun. That's entertainment. So when you look at that, it has everything to do with what we do here, because we have been teaching all those programs for many years, right? So the recent change of that degree program was triggered by some of the changes coming from industry, right? We know that in North America we have a lot of large-scale country clubs, golf clubs, sport clubs, country clubs, right? Disney just recently introduced a new concept, which is called story living. I'm not sure whether you have heard of that, right? They already broken the ground in California. The first community will build in California, Palm Springs, okay? Very close to the first house Roy Disney built, okay? So that was the first community. It's a large-scale community. Part of the requirement was that, you have to be 55 and above, okay? So Disney is moving really from the storytelling to story living. It's a smart strategy of continuing to engage the clientele, right? Because they are very known for connecting with the kids and families and so on and so forth. But when those kids are growing older and older, where do they go? Okay, maybe this is a really interesting, exciting lifestyle kind of community they can be enrolled into. Okay? So that was that. But more importantly, we are in the process of setting up an institute of hospitality in healthcare. And this is actually the topic I want to focus on a little bit. Okay? How a connection can be made between hospitality and healthcare. And also because of that, not only by doing this model, we created opportunities for students. Yes, 15% of our students right now, they are working in non-traditional hospitality industry. If you go and visit any of the local hospitals, Advent Health and Orlando Health, you will be able to see a lot of our students working in hospitals. Why they are working in hospitals? Well, they learned all the business foundation courses. On top of that, they have also been equipped with the culture of hospitality. That is translated into how you communicate with people, how you deal with people, how you serve other people, right? So in the hospital environment, there are so many non-clinical positions, right? Concierge, catering service, different management positions, technology, marketing, promotion, PR, right? And our students are it is very easy for our students to transfer those skills they learn here to the medical field. That's the reason they are here, and they are there, all right? Not only that, this type of model has major impacts on our research enterprise. We are different from medical field, right? Medical field, it is not a big deal if you get a few millions of dollars of funded research, right? From federal agencies or from an industry. In our field, it's very limited. The mindset of industry is not set up like that, okay? Before that model, typically in a year, our faculty members are working on research projects, which was worth of, let's say $300,000. That's it. And that is really the norm for our industry, for our program. But because of this model, we are able to build a lot of interdisciplinary research opportunities by working with experts, professors, researchers from other fields. This is just one example. This is a newly released, research funding initiative from the President's office. All right. So we have been involved in quite a few of those. If you look at the right side, hand side, right, infectious disease and tourism health. Okay. So for that project, we've been working with College of Medicine, College of Nursing, and our contribution, of course, is based on the expertise we have about tourism industry. Okay. So this is a very relevant topic. $4.5 million, sponsored by the university or supported by the university. We're also working with engineering and computer science folks on topics related to alternative energy, in this case, hydrogen. So that's about $1.5 million. And people ask, where's your role? And my answer is, yes, we don't focus on the science and technology behind producing and storing hydrogen as an alternative energy, but we play a very, very important role in connecting that technology, the new alternative energy, right, to the industry. So we have been talking to the hotel companies, Disney's, cruise line companies, airline companies, say, hey, this is a great potential for this new technology, okay? And then how we can work together to make the world, a better place, okay? And there's another one we're working on in the area of artificial intelligence. So within a short, few years, we are moving our research enterprise from $300,000 to right now close to $10 million. That is unheard of in the area of hospitality and tourism. Okay, so this is probably the highest, funding in worldwide, not only here in the country but worldwide. As I said, we have been active on this campus with culinary medicine. We have been doing that for quite a few, 3 or 4 years, right? So these are some of the pictures of the students taking that class. By the way, the students are all medical students, medical school students. But we work together with College of Medicine. We offer the courses here, utilizing our great facilities here. And then typically there are 4 instructors involved in teaching that course. Yes, there's a medical doctor, typically. There's a chef, typically. There's a nutritionist. There's a dietitian. Okay. At the same time, we are also doing the community outreach. You can see from some of the pictures, right? So we introduced the program, actually did a program in some of the disadvantaged communities so that those people can really understand the value of culinary medicine. Just a little bit, based on what I talked about. When you talk about hospitality management, what is it? Yes, it is hospitality. Yes, it is management. But when you talk about hospitality management, you always need to think about the professionalism aspect of hospitality. If you go through our core chat, you will see those 3 core values of the college on the gazebo, right? I'm not sure whether you have noticed that. Is what? Professionalism, leadership, and service. So professionalism is a very, very important component of that. Why that is important? Because, it is important since this is something typically not taught in business schools or management schools, right? In business schools, management schools, they teach you the skills, the foundations, finance and accounting, marketing, management, right? To try to create efficiencies, okay, for your company or create value, right? But we also teach the heart, okay? The compassion aspect of our students. They have to have compassion aspect of, In order to do that, of course, we have to equip our curriculum to nurture the next generation of hospitality workforce who not only have the knowledge and the skills of conduct businesses, but also who have the heart to take care of other people. So that can be translated into the 3 H's principles we follow here. The first H, head. Yes, intellectually, you get to be over there. Smart, understand things, and so on and so forth, right? The second one, hand. You will be able to do certain things. All our students are required to do 3 internships. Okay? 3 internships. Why? Because, our field is a very, very applied field. It's different from mathematics. It's different from chemistry or, physics. You can sit in a classroom or sit in your office and then, make things happen, right? As a manager, of course, you cannot manage your staff very well if you don't know how to do that yourself. That is our strongest belief. The third H is what? The heart. So there's head, is a hand, is a heart. That is the model really supported by this. And then, in a recent few years, this is a trend we have been observing. What is going on is that, more and more people realize the power of hospitality. If we can transfer the culture of hospitality or spirits of hospitality or principles of hospitality into other areas. These are just, a few examples. The skill learned in hospitality, MBA travel across sectors. The example I just mentioned, why our students are working in hospitals, consulting companies, technology companies, right? Retail companies. Because all these environments will require what? Human interaction. And that is where hospitality will play a role, right? And this is another example, USC. They are launching a Masters of Arts in Senior Living Hospitality. Yes, those seniors, they deserve to be better treated. Is right? Okay. So these are some of the trends we just observed. And then, this is the book. I read many times, okay? I have a copy of this book here. Written by 2 medical professors from Cooper's University. It's called Compassionomics. So basically, this is the first book which collected scientific evidence to prove that there's a direct link between compassion and outcomes. And outcomes can be measured by, for example, different factors, different matrix, right? Compassion matters. And then it can be done. Because a lot of doctors will say that, well, I want to be nice to my patients, to people, but I don't have time. You don't understand that environment. Every time you go to your family doctor, right, you sit in another room and then, you're waiting, right? And you expect a great conversation with your doctor, but when a doctor comes, not everybody, but some of them will say, just go over the procedural check and then treat it as a process and treat you probably as an object. Done, okay? See you next year, right? Okay? So, let me start this with 2 quotes. The first one is coming from Martin Luther King. He said, life's most urgent question is, what are you doing for others? What are you doing for others? This is very, very relevant to the medical field. And of course, for us also, as instructors, as teachers, as educators, right? Dalai Lama also says, love and compassion are necessities, not luxuries. Without them, humanity cannot survive. So we should treat love and compassion as air and water. Research also supports that compassion is something intrinsic to the human condition. And compassion is also considered integral to the provision of healthcare. That is a starting point. Probably it's a good starting point. Okay? But how do we look at compassion? There are some other words used interchangeably. Sometimes people say empathy, sometimes people say sympathy, right? But it's different. Empathy is just the feeling, how you feel about certain things, without involving actions. Compassion is not only the feeling, but also action. What do you do to help others? Okay? And obviously, we have a compassion crisis. You have observed all these things taking place in our society. The mass shooting, right? And all these incidents. So we have a crisis in compassion. Now, related to the medical industry, if you look at the just 2 statistics at the bottom, 64% of patients in the U.S. said that they have had a healthcare experience with a lack of compassion. 64%. That's a very high number. 87% said kind treatment by a physician is more important than any other key factors, which can include, for example, wait time, which can include travel distance and cost, right? To be treated well is the number one factor for considering a physician. Okay? I think, this is really related to how we look at the science and the art of medicine. On the left-hand side, that was the traditional view. They are separate. They are distinctive. Okay? We only talk about, for example, the science of medicine. We did not focus on the art of medicine. But in that book, the proposal or hypothesis was that, if you can create a combination between the science and art, that will lead you to best outcome. Okay? And of course, please make sure you understand that, compassion is not the panacea. Don't believe in the moment that, if you have compassion and then all things will be fine. You still need to have a quality cure, quality diagnosis and treatment, okay? Compassion is not or, it is and. So quality treatment and compassion will lead to the crisis. So throughout the book, they collected about 1,000 scientific abstracts and over 250 papers. All this evidence leads to the same conclusion. Compassion can have meaningful beneficial effects on patient outcome in those four areas: physiological, psychological, enhanced patient care, self-care, and increased quality of care. And this is based on empirical data. I know that, many people sitting here, you are researchers, right? For researchers, empirical evidence data is important. As we always say, in God we trust, but all the others, you must bring data when you are ready to say anything, okay? So, as simple as that. We have been trained to do that, okay? So, let me just go over one example in terms of how different communication strategies, non-compassionate versus compassionate one, can lead to different results. So this is a case of Maria, who was 65 by the time of interview, who was diagnosed with Parkinson's disease. Of course, it's not curable, right? The compassionate communication can go like this. Though there's no cure for Parkinson's disease, there are effective treatments to slow the progression, and we can treat it, Maria, and we will go through this together. But unfortunately, what was actually communicated to Maria was the following. Probably I have to read that. It was not good, right? There are two common patterns in the end. The first is that because you have trouble walking, you will fall down and break your hip, and that usually triggers a downward spiral for progressive weaknesses that you won't be able to get out of that. Will lead you to death. The second is that you will have trouble swallowing, and you will choke on your food, and you will die from that. So later on, in follow-up interviews, not only Maria, but also her husband, every time when talking about that, their fist and teeth just clenched. How dare you could say something like that? It's the same communication, same content, right? But the result is very much different. It's very, very much different. So I will just go over this very, very quickly. In the healthcare industry, the cost is going up more and more and higher and higher. So right now, we are spending about 18% of our GDP, about $3.4 trillion on healthcare. The largest in the world. Actually, it's larger than the next 10 biggest countries combined, including Japan, China, Germany, and France, right? About $11,000 per person per year. Yeah? We're not in a good position. If we look at the increase of the cost of other items since World War II, 1945, compare that rate with healthcare, right? I know that, probably this is not a good time to talk about that, right? Gas prices are already going up, right? A gallon of milk will be $48. A dozen of eggs, $55, and a dozen of orange, $134. That is the rate we have been experiencing in the healthcare industry. Of course, I know you know the factual information. Okay? But this is very important. Probably one of the few last slides I want to share. Because people usually say, show me the money before I can do anything. Just like in our industry, we promote, advocate for sustainability tourism, green tourism, right? The response is that, yeah, it's a great idea, but it's a greenwashing type of idea. They say they support that, but in actuality, that is not reflected in their behavior. Why is that? Money. Show me the money. Show me that, this is actually saving cost. Okay? So there's a list of benefits associated with that. Okay? So that is actually coming from one of the major surveys federal government introduced in 2006. Of course, you know that. It's HAPS, right? So Hospital Consumer Assessment of Healthcare Providers and Systems. So if you look at that, the conclusion is that, those hospitals performing better on that survey actually performing better financially. Okay? Plus, for example, you can avoid all these other hidden agendas. So, for example, compassionate care reduces medical errors and malpractice. And more importantly, you can avoid a lot of legal issues. Because a lot of times, legal issues from the patients, they're not coming from the treatment itself, usually. It is coming from what? The perceived lack of care, perceived lack of compassion. That lead to the doctors being sued. Okay? So based on that, this is just one slide I will share. Our proposal is to create this multidisciplinary institute for hospitality in healthcare. And what is the purpose of this one? Number one is to build the first institute that merges the disciplines of hospitality management and healthcare. And number two, to study and document the effects of hospitality culture on the well-being of patients by using the techniques of basic scientific inquiry in a medical and healthcare environment. As I said, if we do that, of course, this will be one of the first in the country and probably one of the first in the world. And then these are the three activities which can be engaged within that institute. Quality of care, well-being of patients, clinicians and administrative staff as revealed through research and training and education. So the current idea is that, we want to make this really a multidisciplinary and interdisciplinary institute. So for this project, we've been working with a few other colleagues from other colleges, from across UCF. That includes the medicine, nursing, health professions, and psychology. Right? So I think, the end message I have is that, you all coming here from different fields with different backgrounds, but with one mission. That is that, to make our society a better society, a healthier society. Some of you treat that or approach that from a food perspective, right? And our approach, of course, is from a service and hospitality perspective. I think, there's a great opportunity for us to work with each other, to create some collaborative mechanism so that we can move some of our missions forward. So with that, I thank you very much for your coming. So safe travel back, no matter where you are coming from. I hope to see you next year. Thank you very much.